Welcome to the deep dive. We're diving into something pretty fascinating today. It's called infective endocarditis, or IE for short.
Wow.
You might be thinking, infective what? But trust me, this is more interesting than it sounds.
I believe it.
Understanding even just the basics of this could save your life or someone you know.
That's a great point.
And a huge thanks to the London HeartbeatsZ Academy in the UK.
Absolutely.
They've given us some incredible material to use for this deep dive.
I'm excited.
Now, if you're enjoying this as much as I am so far,
I am.
make sure to subscribe on Facebook, Instagram, Spotify, and YouTube.
Right.
That way you won't miss out on future episodes like this one.
Absolutely.
Now, I'm joined by expert speaker who can help us make sense of this complex topic.
Happy to be here.
Let's start with the basics.
Sure.
What exactly is IE, and why should we even care about it?
Well, imagine your heart, the powerful pump that keeps you going. It's got an inner lining and valves that control the flow of blood. IE is an infection that attacks this very lining, especially those crucial valves.
So we're not just talking about a simple infection here.
No.
We're talking about something that could really mess with the heart's ability to do its job.
Absolutely.
Wow.
Think of it like this. Those valves are like gatekeepers, making sure the blood flows in the right direction.
Okay.
But when they get infected and inflamed, they can't function properly. Like a door that's jammed, it can't open or close as it should.
Makes sense.
And that disrupts the whole flow.
So you're saying IE can actually impact how efficiently the heart pumps blood throughout the body?
Exactly. Damaged valves can lead to leaks where blood flows backward.
Like a leaky faucet.
Yeah, kind of. Or blockages where the valve opening narrows, restricting blood flow.
So either way, it's bad news.
It's why IE is so serious. Left untreated, it can lead to heart failure or even death.
This is scary stuff. I'm really glad we're doing this deep dive.
Me too.
But who's actually at risk for this? Is it something we should all be worried about?
Well, certain factors can increase your risk. If you've had a previous heart infection, have artificial heart valves, or were born with certain heart defects, you're statistically more likely to develop, i.e., it's like having a weaker spot in your heart's defenses.
So your defenses are down.
Exactly. Makes it easier for bacteria to take hold.
So people with pre-existing heart conditions are definitely at higher risk.
Definitely.
That makes sense.
Yeah.
But are there other risk factors beyond heart issues?
Absolutely.
Yeah.
Certain medical procedures like having a catheter or a heart valve replacement can increase your risk just because they provide a pathway for bacteria to enter the bloodstream.
Oh, that's interesting.
And here's something that might surprise you. Even poor dental hygiene can play a role.
You're kidding.
Yeah.
Bad breath and heart infections.
Yeah.
What's the connection?
Well, think about it. Your mouth is full of bacteria.
True.
Even routine dental work can allow those bacteria to slip into your bloodstream.
Okay.
Usually your body fights them off, no problem. But in someone with risk factors for IE, those bacteria can travel to the heart and cause havoc.
Wow. I never realized that something as simple as brushing and flossing could help prevent a serious heart condition.
It's an important line of defense.
That's a real eye-opener.
Speaking of prevention, if you use intravenous drugs, safe injection practices are absolutely crucial to avoid introducing bacteria directly into the bloodstream.
It seems like even unrelated things can really impact our heart health.
They do.
We've talked about what IE is and who's at risk.
Right.
But how does this infection actually start and develop?
It's a fascinating process, but I'll break it down for you.
Please.
Imagine the inner lining of your heart, the endocardium, like a smooth, delicate surface.
Okay.
Picture a tiny injury to that surface, caused by things like turbulent blood flow or even those pre-existing heart conditions we talked about.
So this injury creates a vulnerable spot.
Yeah.
Like a crack in the heart's armor.
Exactly. And that's where the trouble begins. Microbes, those microscopic bacteria or fungi floating around in your bloodstream.
Right.
They're constantly looking for an opportunity to invade.
Oh, no.
When they encounter that crack in the heart's defenses, they seize the moment. They latch right onto that injured tissue.
Wow. It's like a microscopic invasion.
It is.
But how do they even get into the bloodstream in the first place?
There are many ways they can sneak in. Remember those dental procedures and poor oral hygiene we mentioned?
Oh, yeah.
That's one way. Skin infections, intravenous drug use, or even medical devices like catheters, those can sometimes create a direct pathway for bacteria to enter the bloodstream.
So many ways in.
It's like a microscopic game of hide and seek.
Wow.
Those microbes are looking for any opportunity to slip past the body's defenses
And once they're in and attached to this injured lining,
Right.
what happens next?
That's when things get really interesting. They start to build themselves a fortress, so to speak.
A fortress.
Yeah, forming what are called vegetations.
Vegetation.
These are clusters of bacteria platelets, fibrin, that sticky stuff that helps blood clot,
Okay.
and inflammatory cells.
So they're not just hanging out there.
Yep.
They're building a whole community on the heart valve.
Pretty much.
It doesn't sound good.
It's not. To give you a visual, imagine barnacles clinging to the hull of a ship.
Oh, yikes.
That's kind of what vegetations look like on the heart valves.
And just like barnacles, I bet they can cause a lot of trouble.
You bet.
Hold on a second, listeners.
Yeah.
Before we dive any deeper,
Sure.
if you're finding this exploration of E as fascinating as I am,
I know I am.
make sure you subscribe to The Deep Dive on Facebook, Instagram, Spotify, and YouTube.
Yes.
You won't want to miss the rest of this incredible journey.
Absolutely.
We'll be right back after a quick word from our sponsors.
Okay. So before the break, we were talking about those microbes building their fortress on the heart valves.
Those vegetations.
Right. And as those vegetations grow,
Uh-huh.
they can really start causing
In
problems.
what way?
Well, they interfere with the valve's ability to open and close properly,
Right.
leading to those leaks and blockages we talked about.
So it's not just the infection itself.
Nope.
It's the physical disruption they cause.
Exactly. It's like a bunch of debris clogging up a delicate mechanism.
Makes sense.
But it gets even more complex
Oh.
because your body, in its attempt to fight off the infection,
Okay.
can actually make things worse.
Wait a minute. You're saying our own defenses can backfire?
They can. When your immune system detects an invader like those bacteria causing, i.e.,
Right.
it launches an inflammatory response to try and get rid of it.
Okay.
But this inflammation can sometimes cause more harm than good.
How so?
It further damages the heart valves and surrounding tissues.
It's like a double-edged sword.
It is. The body's trying to fight the infection, but the fight itself can be damaging.
It's all about balance, I guess.
It is. And to make matters even more challenging,
Oh.
we need to know exactly which microbe we're dealing with.
To treat it properly.
Exactly.
Mhm.
Different bacteria respond to different antibiotics.
Right.
So identifying the culprit is crucial.
So it's like a detective case.
It is. We need to know who's responsible.
How do they figure that out?
That's where those blood cultures come in. They're the gold standard for confirming the diagnosis and identifying the specific bacteria involved.
So important.
But before we get into that,
Okay.
let's talk about the usual suspects.
The usual suspect.
Yeah, the ones we find behind, i.e. most often.
Oh, I like this. Give me the rundown.
Well, the most common culprits are bacteria like Staphylococcus aureus, Streptococcus viridans, and Enterococcus species.
Those are some big words.
They are, but they're the ones we see most often.
Got it. So those are the ones to watch out for.
Yes.
You mentioned something earlier about different types of IE.
I do.
Something about native and prosthetic valve endocarditis.
Right. The type of IE depends on which heart valve is affected.
Okay.
Native valve endocarditis is an infection on a valve that hasn't been replaced.
Right.
While prosthetic valve endocarditis affects artificial valves.
The ones that are surgically implanted.
Exactly.
So the location matters. Are there other things that influence where the infection takes hold?
Interestingly, yes. The point of entry can play a role.
How so?
For example, people who inject drugs intravenously are more likely to develop right-sided, i.e.
Affecting the tricuspid valve.
Right. Imagine those bacteria hitchhiking on the needle,
Oh.
getting injected directly into the bloodstream.
Yeah.
Their first stop is the right side of the heart,
Makes sense.
landing right at the doorstep of the tricuspid valve.
So it's more likely to get infected.
Exactly.
That's fascinating. But what about symptoms? How would someone even know they have this?
That's a great question, and it's crucial because early detection is so important.
I bet.
Unfortunately, IE can be sneaky.
Sneaky how?
The symptoms can be quite subtle, especially in the early stages.
Oh, no. So easy to miss.
It can be, and they often mimic other conditions.
So what should people be on the lookout for?
Well, some common signs include fever, chills, fatigue, and night sweats.
Okay.
Think of it as your body's way of saying, hey, something's not right here.
Right.
You might also experience new or changing heart murmurs.
Heart murmurs.
Those are abnormal sounds caused by turbulent blood flow through the heart.
Like a whooshing sound.
Yeah, kind of. Your doctor can hear them with a stethoscope.
Okay. But those are pretty general symptoms. Couldn't they be a sign of other things?
They could, but there are some symptoms that are more specific to IE.
Like what?
For instance, IE can cause what we call vascular phenomena.
Vascular phenomena.
These are problems related to blood vessels.
Good.
One example is emboli.
Emboli.
These are blood clots that travel from the heart to other parts of the body.
Oh, wow.
Imagine little clots breaking off from those vegetations
Yikes.
and getting stuck in smaller blood vessels, causing blockages.
So IE isn't just a problem for the heart?
Nope, it can affect the whole body.
Like a domino effect.
Exactly. Another clue is what we call immunologic phenomena.
Immunologic phenomena.
These are signs related to your body's immune response to the infection.
Okay.
One example is Osler's nodes.
Osler's nodes.
These are tender reddish bumps on your fingertips or toes.
So those are a sign that your body is trying to fight back.
Exactly. It's like your immune system is raising a red flag.
Interesting. And are there other signs like that?
Yes. We also see Janeway lesions.
Janeway lesions.
These are painless spots on your palms and soles.
What causes those?
Tiny blood clots infected with bacteria.
Oh, no.
They travel through the bloodstream and lodge in the small blood vessels of the skin.
So the infection is leaving its mark on the skin.
It is giving doctors a visual clue.
This is all so fascinating. But I can imagine it's a lot to take in.
It can be.
What's the key takeaway here?
Early detection is key. If you have any risk factors and experience any of these symptoms, even if they seem mild, see your doctor.
Right.
Don't wait. Prompt treatment can make a huge difference.
Absolutely. And listeners, if you're enjoying this deep dive as much as I am, don't forget to subscribe to the deep dive on your favorite platform.
Yes.
So you don't miss any of our future episodes.
That's right.
We're always exploring new topics and diving deep into fascinating subjects.
It's a journey of discovery.
Now back to IE diagnosing. It can't be easy given all the different symptoms
You're right.
and the need to identify the specific bacteria involved.
It can be a challenge. But doctors use a combination of tools and criteria.
Like what?
One of the most important is the modified Duke criteria.
The modified Duke criteria.
It's essentially a set of guidelines.
That helps diagnose IE.
Exactly. It helps doctors assess the likelihood of IE.
So like a checklist.
In a way.
Tell me more about how it works.
The modified Duke criteria considers both major and minor criteria based on clinical findings, lab results, and imaging studies.
Makes sense.
The major criteria provide stronger evidence of IE.
Those are the big ones.
They are things like positive blood cultures.
Which we'll talk about later.
Right. And evidence of endocardial involvement, which can be seen on an echocardiogram.
So those are the major criteria. What about the minor criteria?
The minor criteria are more like supporting players.
Okay.
They add weight to the diagnosis.
What kind of things are we talking about?
Things like predisposing factors.
Okay.
Such as a history of heart conditions or intravenous drug use.
Right.
Fever and those vascular and immunologic phenomena we discussed earlier.
The emboli, Osler's nodes, and Janeway lesions.
Exactly.
So it's like pieces of a puzzle helping to create a clearer picture.
Right. Doctors use these criteria to categorize IE
How so?
as definite, possible, or rejected.
So it's not always a clear-cut diagnosis.
It isn't. It can be a bit of a gray area.
I see. And what about echocardiography?
That's a crucial tool as well.
What does that tell us?
It uses sound waves to create images of the heart.
Oh, wow.
Allowing doctors to see those heart valves in action.
So we can see those vegetations.
We can, and assess the extent of valve damage.
And see if there are any other complications.
Exactly, like abscesses.
Abscesses.
Those are pockets of pus that can form around the infected valve.
It's really amazing what we can see with technology these days.
It is. It's revolutionized how we diagnose and treat conditions like IE.
So for our listeners out there who might be concerned about their heart health,
yes,
what's the main takeaway when it comes to diagnosis?
Be proactive. Know your risk factors, be aware of the symptoms, and don't hesitate to see your doctor if you suspect something might be wrong.
Even if the symptoms seem mild.
Exactly. Early detection and treatment are crucial.
They can make all the difference.
Absolutely.
Okay. Let's move on to treatment.
Okay.
Once IE is diagnosed, what's the plan of attack? How do we fight back?
The treatment for IE has two main components.
Okay.
The first is antimicrobial therapy.
Which basically means antibiotics.
Right. We use targeted antibiotics to get rid of the bacteria causing the infection.
So antibiotics are our main weapon.
They are the frontline soldiers in this battle.
But I imagine it's not as simple as just taking any antibiotic.
You're right. The choice of antibiotic depends on the specific bacteria causing the infection.
Which is why those blood cultures are so important.
Exactly. It's about choosing the right antibiotic for the job.
So it's a personalized approach.
Precisely tailored to each individual patient.
I like that. But sometimes antibiotics aren't enough, right?
Unfortunately, that's true. Sometimes surgery is necessary.
When would that be?
Typically when the infection has severely damaged a heart valve,
Okay.
leading to a major leak or blockage of blood flow.
So the valve isn't working properly.
Right. And surgery is also recommended if there are complications like those abscesses we talked about.
So surgery is like the damage control team?
It is repairing or replacing the damaged valve.
To restore normal heart function.
Exactly.
It really highlights how serious this condition can be.
It does. IE is not something to take lightly.
Let's go back to those blood cultures for a minute.
Sure.
They seem so crucial for both diagnosis and treatment.
They're the gold standard for confirming IE.
And for identifying the bacteria causing the infection.
Exactly. Remember, those bacteria have entered the bloodstream and settled on the heart valves.
Right.
A blood culture allows us to isolate and identify them.
It's like a detective catching the culprit red-handed.
It is. We take a blood sample and grow it in a special medium.
To see if there are any bacteria.
Right. And if there are, we can figure out exactly which species it is.
So we can target the treatment effectively.
Exactly. But we usually need more than one blood culture.
Why is that?
Because the concentration of bacteria in the blood can fluctuate.
So one sample might miss them.
It might. Taking multiple samples increases our chances of catching them.
Makes sense. So how many samples do you usually take?
Ideally, 3 sets from different veins over a 24-hour period.
Like casting a wider net.
Exactly.
And timing is important too, I bet.
It is. We want to take those samples before starting antibiotics.
Because the antibiotics could interfere with the results?
Exactly. Antibiotics can suppress bacterial growth.
Making them harder to detect.
Right. So we aim to collect those samples before starting any treatment.
Wow. It's a race against time.
It can be. But once we have those cultures and know what we're dealing with...
Then you can start the right treatment.
Exactly.
It all comes back to that personalized approach.
It does.
Well, this has been an incredibly informative deep dive into the world of infective endocarditis.
It has.
Thank you so much for sharing your expertise with us.
My pleasure.
And a huge thank you again to the London HeartbeatsZ Academy in the UK.
Yes, their material was fantastic.
For providing the excellent resources for this deep dive.
Absolutely.
Listeners, if you enjoyed this and want more deep dives like this,
There are plenty more to come.
make sure to subscribe to the deep dive on Facebook, Instagram, Spotify, and YouTube.
We'd love to have you join us.
Until next time, stay curious.